to watch now.
Florida continues to struggle with a COVID surge as hospitals fill up and healthcare workers burn out. The state has set another pandemic record with more.
Hello, today I present to you an extremely attractive application for music lovers. It's completely free. You can listen to music online or download unlimited music to use whenever you don't have internet. The powerful search function helps you find anything you want. Trust me. It's hard not to find what you're looking for because the search function is really powerful. Application download link is attached in the description of the video. I'm pretty sure you'll like it. Thanks.
More than 15,000 people currently being treated for the virus. More than 3,000 of those patients are in intensive care units, and kids return to school in some parts of the state amid a highly politicized debate over masks. Several school districts are defying the governor's ban on mask mandates, even under the threat of sanctions. Manuel Bojorquez has more from Miami.
Trying to encourage everybody to please take this Delta variant very seriously due to the transmissibility. It is incredibly contagious, and our children are getting sick. I can't do this.
Pediatric doctor Pia Myers got emotional as she recorded a video message for the public about the challenges in Collier County. Florida leads the nation in pediatric hospitalizations, with more than 300 reported in the last week. Children now account for nearly 15% of all new infections nationwide. That's why the American Academy of Pediatrics is pushing the FDA to approve the vaccine for kids ages 5 to 11. Dr. Yvonne Maldonado is the organization's chair of infectious diseases.
Do you fear what will happen in a state like Florida as schools begin?
Well, we see what's already happening in Florida, and we don't want that to happen in schools.
We love teachers! Protests erupted on both sides in Florida after the governor banned schools from requiring masks and even threatened the salaries of superintendents and school board members who defied him.
My view is it's a parent's decision. If you believe in the masking during the school, you're free to do it.
But that didn't stop Broward County, the state's second largest school district, from voting Tuesday to require masks.
I can die if people do not have their masks on.
I don't feel comfortable with my son having to go into school and having to wear a mask the entire day, 5 days a week.
Our educators in the state of Florida, they are going to be there for the kids, as they have always done.
Andrew Spar is president of the Florida Education Association. For him, it's personal. His wife is a public school teacher, and his youngest daughter is entering 7th grade.
I'm concerned about my daughter, who is vaccinated and will be wearing a mask, and the fact that there will be others who are not vaccinated and are not wearing a mask. And so we want to make sure that everyone is safe.
There is some encouraging news when it comes to vaccinations across the country. According to the CDC, the pace of first doses is nearly double what it was 30 days ago. Vlad, Anne-Marie?
All right, Manny, thank you very much. To dig a bit deeper into this, let's bring in urgent care nurse practitioner Justin Gill. So, Justin, the pandemic has intensified student safety as a major concern for parents. The CDC says that the COVID-19 risk in school is high because so many children remain unvaccinated. So, do you believe that masks are fundamental for student safety?
Well, thank you so much, Vlad, for having us or having me on today. I think that I would definitely agree with that masks are something that we know works. It works for protecting transmission of COVID-19 amongst both vaccinated and unvaccinated groups. Children are particularly unique. One reason is because under the age of 12, they cannot get the COVID-19 vaccine, at least currently in the United States, which means that they can certainly both transmit and infect other students around them in a closed-door environment, and even more so with the Delta variant, which we know is much more transmissible with unvaccinated individuals in one room that may not be wearing masks. And, you know, we have some precedents for this. We know that masks have worked in the past when it came to COVID-19 before we had the vaccine. So this seems like it's a common sense approach to being able to prevent further transmission among children who may later bring back that viral infection home to other loved ones or other individuals that might be immunocompromised or vulnerable. And, you know, I would say it's extremely frustrating when some of these announcements go out that are not allowing local school boards to make these kinds of decisions, because, you know, I disagree with the governor that it's not just an individual decision. And I've seen this on the front line. It's something that impacts every other student and family around them. So these types of decisions should be allowed to be made by local officials and not necessarily kind of penalize or thwart good public health guidance that comes out.
So this is going to remain a concern as long as children under 12 don't have access to the vaccine. We're seeing an uptick in child COVID cases. We're seeing an uptick in hospitalizations. It makes sense. They're not protected. The American Academy of Pediatrics is urging the FDA to approve the vaccine for kids under 12. How soon could that happen?
Yeah, so the recent estimates as far as time frame goes that I've seen is sometime by midwinter that we could see an emergency use authorization come out, although that may vary based on the data that's submitted. And I can completely understand with where the American Academy of Pediatrics is coming from, because everything that we do in healthcare and in medicine is weighing risk and benefit. And we have to look at the risk that's applied here when we allow students to go back to school, in some cases unmasked, spreading COVID-19 further, and potentially leading to bad outcomes, yes, even amongst children. And we have to kind of weigh that against the risks associated with vaccination, which are extremely low. I understand that there's an additional threshold for rigor as far as evidence goes for children, particularly because they're a vulnerable population. And I can see why the FDA would have wanted more information in order to establish trust in the vaccine. But again, you have to be able to weigh those risks and benefits in every scenario in healthcare in order to save the most lives and improve the most outcomes.
Kids aged 12 to 17 have the lowest vaccination rate of any eligible group. There's a new poll that found that about half of the parents that are holding off on getting their kids vaccinated, they're doing that because they largely fear side effects. What's your advice to those families?
Yeah, my advice to those families and many of those younger kids and even young adults is that this is a vaccine that we know works. COVID-19, especially with the Delta variant, is something that affects every age group. Now, it might affect them at different levels, but we do know that many of the concerning adverse outcomes that we've seen reported with COVID-19 vaccination many times occur at a higher rate, such as pericarditis, myocarditis, in actual COVID-19 disease. So, I tell folks that, including my generation, a millennial generation, that we all not only have a responsibility to protect every other person around us, but we have the ability to protect ourselves in this case with a vaccine that we know works, has good data behind it, with limited, mild side effects that oftentimes go away within 12 to 24 hours after the vaccination for most folks. So again, that risk and benefit discussion applies here, even for younger individuals, including children and adults, as far as preventing COVID-19. Because we've seen the bad with COVID-19, and we've seen the good as far as what the vaccine can do in preventing transmission and actually minimizing the severity of disease if you did get potentially a breakthrough infection.
So COVID hotspots like Florida, Oregon, Louisiana, they're seeing shortages when it comes to nurses and other frontline staff. Now, when this sort of thing was happening at the beginning of the pandemic, when we were sort of maybe a year ago, a lot of it was explained away by the fact that, some of these frontline workers were getting sick themselves, and so they had to be taken out of the rotation. I would think at this point, though, that would not be an issue because these frontline workers would be vaccinated. So why is there a shortage in some of these places?
Yeah, I think that this is something that is kind of multifactorial. So healthcare staffing shortages, nursing shortages, all of those types of things are longstanding even before the COVID-19 pandemic. Much of that had to do with training and access to programs that would be able to prepare them to take care of patients. COVID-19 has added another layer of complexity where you have a workforce that's been battered by this virus for the past year and a half. You have people that are leaving the profession due to burnout. You have limited numbers of people wanting to get into the profession because they see the demand that's placed on many of these professionals. So, I think that a lot of it, at least initially when it came to supplies, PPE, resources, burnout, working extra shifts, all of those things have contributed to it. And we're seeing some kind of marketing from other areas of the country to get workers to come to their areas of the country, paying, I would say absurd sums of money to be able to get many of these nurses and healthcare workers to work for them. But I think at the same time, it doesn't really address the structural problem that many of these states face, which is lack of vaccination amongst a majority of their populations. It's a difficult thing to be able to get healthcare workers in a short period of time to take care of an unprecedented number of patients. Even out here at home, where we have a high vaccination rate, we have other health conditions besides COVID-19 that people are seeking care for. We ourselves have seen an uptick in volumes. When it comes to vaccination, I would say, our healthcare workers are the front line. They need to be vaccinated and show our communities that, one, this vaccine is safe and that it can prevent severe disease and hospitalization. If anybody is in a position where they have the most influence to be able to, encourage confidence in the vaccine, it's healthcare workers. Our progress made by vaccination amongst our community members can be thwarted or blunted by, hesitancy that might be demonstrated amongst healthcare workers, or spread of misinformation, which can be much more harmful to communities that are potentially hesitant to the vaccine.
Yeah, all really good points, and thanks for clarifying.